Assalamualaikum and hi everyone. Today we are going to discuss a topic about speech therapy. Our group consists of 4 members, including me. I'm Rachel Fabia Yo Pejun, Amira binti Abdul Ghani, Nur Aini Akila binti Muhammad Yamin, and also Siti Nur Farina binti Roslan. So what is speech therapy? Speech therapy is the assessment and treatment of communication problem and speech disorder. It's often performed by speech-language pathology, which often known as speech therapists. Speech therapy is also a technique that used to improve communication. This includes articulation therapy, language intervention activities, and other depend on the type of speech or language disorder. Language disorder refers to understanding or putting words together to communicate ideas. Language disorder can be either receptive or expressive. Receptive is a problem understanding or processing words, while expressive is a problem putting words together, having limited vocabulary, or being unable to use language in social appropriate way. Speech therapy may be needed for speech disorder that develop in childhood or speech impairment in adulthood that caused by injuries or illness such as stroke and brain injuries. Next, we will move on to the functions of speech therapists. Speech therapists can help children with different kinds of speech difficulties as well as language issues such as dyslexia and dysgraphia. Speech therapists can help children to hear and distinguish specific sounds in words. For example, the word cat, C-A-T, cat. The therapist will break down into C-A-T, K-A-T, cat. This can improve the children's reading comprehension and also encourage them to read. Moreover, speech therapy can help children to speak more clearly. This can help children to feel more confident and less frustrated to speak to others. Children who have language issues can benefit socially, emotionally, and also academically from speech therapy.
Now, I will continue to the prevalence of speech disorder. The prevalence of speech disorder in young children is 8 to 9%. By the first grade, roughly 5% of children have noticeable speech disorder. The majority of these speech disorders have no known cause. Usually, by 6 months of age, an infant babbles or produce repetitive syllables such as ba 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 or da da da. Babbling soon turns into a type of nonsense speech called jargon that often has the tone and cadence of human speech but does not contain real words. By the end of their first year, most children have mastered the ability to say a few simple words. By 18 months of age, most children can say 8 to 10 words, and by age 2 are putting words together in crude sentences such as more milk. At age 3, 4, and 5, a child's vocabulary rapidly increases, and he or she begins to master the rules of language. Stuttering affects individuals of all ages, but occurs most frequently in young children between the age of 2 and 6 who are developing language. Boys are 3 times more likely to stutter than girls. Most children, however, outgrow their stuttering, and it is estimated that fewer than 1% of adults stutter.
Greetings. My name is Siti Nur Farina binti Roslan. and for today I will be presenting the procedure of speech therapy. According to speech therapists, the age of 1 until 3 is a critical period of development for children. If they are unable to talk, it is better for parents to look for help quickly so that they could polish their skills and develop the skills that they are lacking by. In order to do this, the parents must always pay attention to the child development. If the parent thinks that their child are lacking by or have delays in any kind of development, the parents should take the child for referral at the doctor so that the doctor can diagnose what is wrong with the child. Early diagnosis is better because early intervention can help to prevent unwanted delays in the child life which could affect the child's future. After the diagnosis have been made by the doctor and the child is being confirmed to have a speech delay problems, then the doctor or the parents itself can make an appointment or a schedule to the speech therapist to help the child. When an appointment is being scheduled, the parent is required to give information of the child development, the child milestone, and also the odds that happen to the child which causes the parents to refer them to the doctor or to the speech therapist. The information given by the parents are very important to the speech therapist as they help the therapist to determine what type of problem that the child is facing, what type of treatment should they give, and how long do they need to do session with the child in order to help the child to speak better. At this point, the speech therapist will look at the child's speech, specifically the child's speech sound and the pattern of the speech the child is producing, the language, what the child comprehend when others are talking, and what the child could produce, the fluency of the talking of the speech produced, the voice quality, the child's memory, the feeding, and also the swallowing of the food or saliva. All of those mentioned above are what which could cause a child or a person to have a speech problems. After the problem had been identified by the therapist will then take some time to think about what type of treatment is suitable for the child and how many sessions does it take to help in improving the child's speech skills. When the therapist had confirmed the type of treatment which they would give to the child and also the session that will be held for that child, the terms are then being told to the parents so that agreement could be made. However, there are some cases which needed the treatment to be done in a longer period as there are drawbacks in the progress. This type of cases usually happen with kids whom have speech delay and also autism.
Hi everyone, my name is Nuraina Akila binti Muhammad Yamin. Today I will explain about strategy to improve speech therapy. There are 4 strategies to improve speech therapy. First, use online technology for parent training and coaching. Second, improve the interacting with students with speech impairment. Third, improve caregiver and parents' awareness about additional at-home speech therapy. Fourth, using music and singing in speech therapy. The first strategy is use online technology for parent training and coaching, or in other words, telepractice. Researchers and practitioners have found that telepractice is an effective means of increasing access to high-quality service that meet children's unique needs and is a viable mechanism to deliver speech-language service for multi-purpose. Telepractice refers to service provided from a distance using video conferencing or other technologies. Because the technology to support video conferencing has developed rapidly in recent decades and access to the internet has become increasingly available, telepractice has emerged as another means of delivering service enabling speech-language pathology to provide effective services to individuals with speech communication disorder, and delays. Some examples of these benefits include reducing the expenses and time associated with travel and with rescheduling cancel or miss appointment. Second, telepractice has been identified as a medium for increasing access to services for clients living in rural areas or in neighborhoods perceived as unsafe by service providers. The second strategy is improve the interacting with students with speech impairment. It is very important for teachers to be in close proximity to the student and to listen closely to the student's speech so that the teachers can assess the student's speech as well as clearly hear what they are saying. Some studies also recommend repeating or paraphrasing the student's speech once they are finished speaking so that the other student can understand what the student are saying. This will also show the student the correct way of saying certain words. Conversation among the entire class and including the student with speech impairment in the conversation so that they can practice using their speech. The third strategy is improve caregiver and parents' awareness about additional at-home speech therapy. At-home speech therapy, parents and caregivers can read to their child regularly and frequently. After reading a page, discuss what was just read and what might happen next to improve language comprehension. After that, at-home speech therapy also can make a game out of naming objects and having your child point to them to build his vocabulary. This will be interesting to the children to participate. During the camp, parents or caregivers should practice following simple directions to their children, but try to make them fun. For example, give mommy a hug and tickle your little brother. If the children win the game, the parents should give them rewards. Rewards can be great at keeping children working towards the end of an activity. Be sure to alert the child as to how much work they have to do in order to earn the reward. Work for 10 minutes, 5 worksheets, and 5 articulation targets. And encouraging the child to indicate when he does not understand something. Example, shrugging. So the parents can explain it to them. The last strategy is using music and singing in speech therapy. Based on many studies shows that music and singing can help people release their stress and tension. But we also should remember that music and singing was really helpful in order to improve speech therapy. Music-based intervention for the recovery of oral language production in aphasia has been shown to be particularly effective in patients with Broca aphasia compared to other aphasia subtypes. It has been suggested that this therapy might improve language output by ending motor speech deficit often associated with Broca aphasia. In non-fluent aphasia, words can be better produced when patients sing familiar song or novel lyrics in synchrony with an auditory model compared to when speaking. Music-based intervention have leveraged this ability for improving speech and language in aphasia patients.
My name is Amira Abdulgani and I will be presenting for the advantages and disadvantages of the speech therapy. There are three advantages of speech therapy, which are fluent speech, better quality of life, and developed social skills. The first point is fluent speech. Speech fluency disorders are conditions such as stammering or stuttering, cluttering, or even mumbling. Therefore, a speech therapy can teach you to slow down your speech and learn to notice when you stutter. You may speak very slowly and deliberately when beginning a speech therapy, but over time, you can work up to a more natural speech pattern. Next is better quality of life. As we all know, limitation of communication affect the quality of life where people could not understand and interact with one another.
This is very frustrating for the person themselves and even the people surrounding them. With the help of speech therapy, it helps people with speech problems to improve their speech and communication skills, which eventually build a better quality of life. The last point is to develop social skills. Children with autism often struggle with engaging in social interaction with their peers as they may process expressive language, receptive language, and nonverbal cues differently than a child who is typically developing. All of these aspects of communication are necessary for developing social skills. So if a child experiences delays in any of these areas, they may struggle with building social skills. A speech therapy will use a variety of strategies to build these skills, depending on the unique needs of the child. By speech therapy, on modeling language skills, the child is exposed to more language during the process of developing their own communication and social skills. Meanwhile, there are 3 points for disadvantages, which are time consuming, may seem to promise than it can deliver, and cost. The first point is time consuming. Speech therapy is a time consuming for both the parent and the child. It takes a long process, dedication, and patience in order to see the outcome of this therapy. Furthermore, each therapy session are not enough in which the lesson from the session must be carried out throughout the week, at home, and in the community. Therefore, it can add stress on a family that are already trying to cope with a child's therapy routine. Next, speech therapy may seem to promise more than it can deliver. Every children are different with one another, in which some may easily acquire intelligible vocal speech while others may not. This can often be difficult for parents to accept. Thus, in developing a speech therapy program for the child, parents often expect high expectation on the child progresses that eventually put pressure on the child and stresses out the parent. The last point is the cost. Cost may be a concern in the case of a financial problem situation among parents which they can't afford to cover speech therapy or speech therapy for specific condition on their child. As a conclusion, speech therapy is the assessment and treatment of communication problems and speech disorders that can be treated in a broad range of age. It is one of the important therapies as speech and language are central to the human experience and which they are the vital means of people convey and receive knowledge, thoughts, and feelings.
Hi everyone, my name is Nurani Akila binti Muhammad Yamin. Now I will continue to the reason why we choose the topic of speech therapy. The first reason is speech was one of the very important part in human development, especially for children development. Second, to get a new knowledge about how to be a speech therapy. So, we go to the first reason, which is speech was one of the very important part in human development, especially for children development. Speech pathology work in both children and adults. The patient often suffer from a wide variety of problems, such as late development, cleft palate, hearing loss, mental retardation, brain damage, stroke, or emotional problems. It is important that children with suspected speech disorder be screened yearly because research has shown that this disorder can lead to learning disability later in life. The elderly often need assistance as their hearing declines with age. Not that only, if the children have speech disability, it will also affect their future social communication. After that, we move on to the second reason, which is to get a new knowledge about how to be a speech therapy. As we all know, the speech pathology or speech therapy is a member of a group working together for the good of the patient. Speech pathology or speech therapy cannot be impatient, random people. A speech therapy must be caring person. His or her heart must be filled with compassion and love, but also with determination and intense concentration. A speech therapy is someone that truly wants to give to another person. The speech therapy might even feel pity for the patient, but that is not what is needed. A sharp a sharp sense of direction and deep concentration on the progress of each and every individual is vital not only for the success of the patient but for the speech therapy too. He or she must be possessed a good sense of objectivity and must not be frustrated by slow progress. A speech therapy also needs a keen eye for details. The details are often the key to helping a person unlock his or her voice. A speech therapist should be able to consult his or her patient and the patient's family. One must not only be a therapist, but a friend, a role model, and a confidant. Being a speech therapist is one of the most rewarding careers available. After spending one's time, effort, and concentration on a person, a speech therapist gets to see the end result. Watching a shy child become one of the most articulate students in class, or seeing a husband tell his wife that he still loves her is almost payment enough. So, based on my reading, there is a lot of knowledge that I can get how to be a speech therapy in the future.
The reason why we choose this topic because it is crucial for children who have limited communication will receive an ongoing therapist so that they can express their feelings and thoughts. Besides, it also enables them to speak so that others will understand them. This makes the topic interesting and make us want to discover more. That's all from me. Thank you.